Thank you very much. Yeah, I started sitting down there and I forgot for CIPHER we all have to sit on the stage, so I had to quickly rush up. But thank you for inviting me to talk here. I'm going to talk about event-triggered data collection in an understanding society in the innovation panel. You may not be aware of this study. It's the UK Household Longitudinal Study. It started in 2009, but it also incorporates part of a British Household Panel survey from 91. It's a household panel, so we try and interview everyone in the household, age 16 and above. 10 to 15-year-olds get a self-completion interview, and we ask about everyone in the household, so there's child development questions and so on. And it's an annual interview, and we follow people each year, and we interview them as long as they're in the UK and anyone they're living with. It started off as face-to-face, but then has become more mixed mode, particularly from wave 8 onwards. It's been mixed mode with 40% being invited to take part online at wave 8, going up to about 90% at the moment. And all those who take part, about 90% of people take part online. But I'm not going to talk about that bit. We also have an additional innovation panel. So this started a year before the main survey. It's about 1,600 households, and this is used to test new survey questions, new survey procedures and protocols. And so I'm going to talk a bit about the innovation panel, but not mostly about that, mostly about something called a life event survey, who's drawn from the innovation panel. So on our main study, each year we collect what is happening to the person at the time. So at each annual interview we're asking, so what are you doing now? What's happening now? But then we also have recall questions. So we go back to the last time we interviewed you on so-and-so date. What's changed with your health, with your partnership status? Last time we interviewed you, you told us you were working as so-and-so. Are you still doing that? And so we try and collect information to fill in the gap between the two annual interviews. But the problem with that is that it's sometimes difficult to collect that level of detail retrospectively. So if you had like a health incident or a short period of unemployment, maybe 9 months before the interview, when we come and talk to you, you might not remember that. You might not remember the details, exactly when it started, when it finished. And we wouldn't be able to collect subjective information. So how did you feel when that happened? What were your expectations or your plans? How were you planning to manage around those? And so we wanted to develop methods where we could collect data closer to the point where these events occurred. And this was what we called the Life Event Survey. So this was a monthly web survey. So we took our innovation sample participants and we allocated 2/3 of them to this Life Event Survey. And then every month we sent them an invite and a reminder. The fieldwork period was very short. It was only 7 days for each life event because we wanted to collect the data fairly close to the point at the beginning of each month. We had a couple of experiments, one with reminders, a reminder every day versus a reminder every 2 days, and then some with incentives, so they were offered £1 if they took part, and then another part of the sample were offered £1 to take part and £2 if they reported any events. So as I say, the fieldwork was quite short, and it's about 1,000 households eligible because we only invited 2/3 of the innovation panel. So the event question itself was quite simple. Did you experience any of the following during the last month? And these are the different domains that we asked about. And then it was just a simple yes or no. And if no, that was it. They finished the survey, they were done, they got their £1. If yes, we then asked them some follow-up questions about the event. So more information about the health event, or where did they move to and who moved with them, what job have they moved to, and then questions about their well-being. And we actually found that response crept up over the 12 months. So we did this 12 months, and almost each month we got slightly more people taking part. As you can see here, we did have some people who opted out of the survey, so they stayed within Understanding Society, but they didn't want to take part in the life event study anymore. But the response itself was relatively stable. And we did get complete, or at least usable data for a large proportion of respondents. So just under 60% completed all of the waves, and these are of anyone who took part in one of the life event study. And Another 9%, we just had one missing wave, and then another sort of 6 or so percent, we had multiple gaps, but at least, a maximum of one missing wave each. So about 75% of people, we got pretty good usable data. Of course, one of the strengths of having this based on the Understanding Society Innovation Panel is that we know a lot about these people. The Innovation Panel had been running for 12 or 13 years, so we have information about who we've invited. So we also know who didn't take part. So we can see that people are under or overrepresented in the life event study. And these three bars are people who are internet users, plus we have contact details, and then people who responded. So for example, for the youngest age group, the 16 to 20s, they were actually overrepresented in the life event study of people who were in internet user households. But we were missing contact details for a lot of them. So when we added their contact details, they were actually underrepresented, and then they were also less likely to respond. So compared to the overall sample, they were underrepresented by 3.5%. For the next age group, they were in internet using households, and we had contact details, but we lost them at the response stage. So when it came to responding to the life event, they were underrepresented. Whereas for the older age group, where we lost them was they weren't in households where people use the internet regularly. So that's where they became underrepresented. We had contact details and they were willing to respond, but we lost them because of the coverage problems. So we know that people were under or overrepresented in this life event study. We found a small effect of incentives and reminders. So the £1 plus £2 for reporting events across the 12 waves increased response by about 2.5 percentage points, and slightly smaller for the reminders. Having a reminder every 2 days actually seemed to be more effective than every day. Increased response over the 12 waves of just over 2%. And the quality of the data was actually pretty good. Although 11% of respondents seemed to report the same event in 2 consecutive months, perhaps telescoping, we thought maybe they were misremembering where it was. When we went through and had a look at those events and how they described them and what they said about them, we think only 2.5% of respondents were coded as definite or probable duplicates. And the item non-response in the follow-ups was also very low, about 3%, and that didn't differ by incentive group. So if we were giving them an additional incentive to report those events, they weren't more or less likely to have item non-response. And the item non-response actually declined throughout the period. So our key findings was that there was no effect of the invitation to the life event study on the annual interview. So we only invited 2/3 of households to the life events, and we kept a third back. So then when we looked at response at the next annual interview, there was no difference between those who had been invited and those who hadn't been invited to the life event study. And there's no effect on reporting of events. So people who had already reported events in the life event study, when we asked them in the annual interview, since the last time we interviewed you on the annual interview, what has happened, they were reporting the same events. The monthly response rates were stable and actually increased slightly. And the reasons for non-participation, we could sort of divide them between non-coverage, where we just didn't have any internet users in the households, non-contact, where we didn't have the contact details, and then non-response, so people who just didn't want to take part. So our next steps, and this is what we're doing at the moment, we've got some phase 2 planning, phase 2 testing planned. We're consulting on the questionnaire, so we're talking to people like labour economists. We know what is it that they want to know if they could interview someone just after they've got a job or just after they've lost a job. What do health researchers want to know on the onset of a health event? And then we're planning to eventually roll it out onto the main sample. We've had some related experiments in parallel with the life event study, so we're looking at ways to improve contact details. So we've had a couple of experiments on the innovation panel where we're trying to improve the proportion of people where we have contact details, and we have managed to increase that proportion, so we have now more people with mobile numbers, more people with email address. We also are thinking about how can we make it easier for people to take part. So we could actually send that initial life events yes/no question by SMS, and then they can just respond yes or no. If they say no, it's finished. If yes, they then get a follow-up SMS with the link to the survey. But initially, we only asked for people's mobile phone numbers so we could keep in contact with them if they moved. So we hadn't got their agreement to use that phone number to actually collect data. So we've had to ask for consent. And we got 70% consent. And then of non-consenters, we asked them again 2 years later, and just over half gave consent. So this is what we're doing now, and this is what I'd like to discuss or get your feedback. What can we do now to increase coverage, contact, and response? Thank you.